this hospital on your own. We are very sorry, sir.
Okay, I take her on my bike.
Good evening and welcome to the Maternal Health Channel television series. My name is Anita Erskine. Malaria is a leading cause of death in Ghana and affects everyone. Children under 5 and pregnant women are particularly vulnerable. The economic cost to families is also significant when members or caregivers fall sick. Malaria also represents a huge burden on the economy. In 2014, the cost to business in Ghana was $6.5 million. 90% of these were direct costs and 10% due to productivity losses resulting from employee absenteeism. Preventing malaria is therefore critical and can yield significant benefits to us as individuals, as communities, and the country as a whole. However, how effective is our treatment of malaria? Is it a fact that not every fever is malaria? Do we go to the hospital to test for malaria before we start taking medication? Tonight, the focus is on testing, treating, and tracking malaria for effective reduction of the disease. Before we discuss this with our studio guest, let's visit Dabala in the Volta region, where we meet Mr. and Mrs. Ameuda, who suspect their daughter has malaria.
In the small village of Tosukpo in the Dabala district of Volta region lives Mr. Ameuda, his wife Pearl, and their 3-year-old daughter Joanna. Joanna has not been well for a few days now. Today she feels worse with high temperature and some vomiting. Mr. Ameuda suspects malaria and was thinking of going to the local chemical shop to get some anti-malarial drugs, but he wisely decides to take her to the hospital.
I like to take you to the hospital and then check what is wrong with the baby.
Not every fever is malaria. The common practice that you see a lot of us doing, the moment we have fever or we think we have malaria or we are not well, straight away we go to any chemist or pharmacy shop and tell them that, oh, I think I have malaria, give me so and so. Or at times, you may even have some medication in the house, and because you think you have malaria and the fever, you take it. But you don't know the cause of that fever. It can be a very serious problem that you're having. And because you think that you have taken medication and you don't go to the hospital to be tested, you might end up having a problem or even dying. Straight away, you have to go to the hospital and then be tested. And then we can really know that this is the problem that you're having.
Mr. Ameuda has called for a motorbike rider and he arrives promptly. Dabala Health Center is not too far and they arrive quite quickly. Joanna is attended to by a nurse who tests her for malaria. The test is positive.
A few days now, she is not feeling well.
Okay. She's not eating well.
Mr. Robert Essien, the physician assistant, conducts a diagnosis and prescribes a course of artemisinin-based combination therapy, popularly known as ACT, and some vitamins for Joanna. Ms. Ameuda collects the drugs from the pharmacy and leaves. Happy, he brought her daughter to the hospital.
The moment you are tested and the test show that you have malaria, you are treated promptly with quality anti-malaria medicines. And it's important that you complete the whole dosage. You don't break it because you think I am feeling well, therefore the malaria is gone. As part of the treatment, it's very, very important that you complete the whole dose. And especially in children, if you give it to them and they vomit within 30 minutes, you have to repeat and actually complete the whole dosage.
After 3 days, a community health nurse calls on the family to find out how Joanna is doing and to ensure that she has completed her course of malaria treatment. From then on, the family makes it a point to sleep under a long-lasting insecticide-treated net at night and throughout the night.
So now that we've seen that documentary, we have in our studio Dr. Adomako Boateng, who will take us through T3, test, treat, track. Dr. Adomako Boateng, you're very welcome.
Thank you.
Now, let's bring it back to the basics. Why must malaria be prevented?
Oh, we have a number of reasons for that. When we are normally talking about malaria, we are looking at different populations. We are looking at the at-risk population, and the at-risk population, basically, we are talking about children under 5 and pregnant women, and the normal population. At-risk population, children under 5, they are at risk because, one, they don't have partial immunity to malaria as the adults we do. And then when they get malaria, the progression to severe disease is so high that if you really don't do anything about it, the likelihood of them dying is so high. Then secondly, because they don't have what we call partial immunity to malaria, the frequencies or the episodes of malaria is really high. We also know the complications associated with malaria, one of them being anemia, that will further on lead to stunted growth. Their intellect is affected, school days are reduced, and therefore we are going to have, in terms of intellect, they are going to come down, and the likelihood of them dying.
What about pregnant women?
Pregnant women, it's also very important that we prevent malaria in pregnant women. Why are we saying that? You know, because of the level of our endemicity, we have high transmission of malaria, and it's presumed that everybody is having some kind of parasite, Plasmodium parasite in. It's a presumption because of the level of endemicity. And then when women become pregnant, they are at risk because the likelihood of them getting malaria is about 4 times. Then also the likelihood of them getting severe forms of the malaria is about 2-fold as compared to what the non-pregnant women. And also other issues like stillbirth, miscarriage, as we know as stillbirth, reduced stunted growth, we call it intrauterine growth retardation, the likelihood of the mother aborting, having preterm delivery.
Your advice for prevention is clearly understood, but what about the treatment and control? Give us a broad view of our preventive measures, how effective they are currently.
It's very important that once you are having your body temperature is high, you have to go to the hospital or health center or any health facility to be tested for us to be sure it's what? Malaria. Every suspected case of malaria should be tested. That is the T, first T.
Bring me to the second T, which is treatment.
Every confirmed malaria case should be treated. That's the T2. And then the treatment should be prompt with appropriate, quality assured anti-malaria medicines. In Ghana, we have what we call the popular ACTs, artemisinin-based combination therapies. So you hear a drug like artemether lumefantrine, artesunate amodiaquine, P-alaxin. These are tried and tested drugs that are used in the management of what? Malaria.
So, Doc, take me through why it's important to then track. I guess you are tracking the person's progress as far as the malaria is concerned, and even what happens afterward. The third T.
Okay.
Why is it important to track?
And before we even move to the third T, why is it so important that you have prompt and appropriate treatment? Because if you don't have prompt treatment or appropriate treatment, what is going to happen is that you are going to progress to what we call severe malaria or complicated malaria. And especially for children under 5, because they have partial immunity, progression is so fast as compared to the adults. So we don't have time when we are dealing with uncomplicated malaria in children. You need quality medication, and it has to be prompt. And it also applies to the pregnant women. You have to be prompt, and it has to be, you need quality drugs. Other than that, they will also progress to what? The severe disease. Because for the severe disease, treatment is more expensive because you have to go for admission. Mortality, the likelihood of dying from severe disease is so high. And that's why it's so important that the moment you are confirmed to have malaria, you have to go for any of these ACTs that we have discussed. And then after you have been treated, the other point that we are saying track is that every confirmed case of malaria that has been treated should be tracked.
So, Doc, in the documentary, we saw that the community health nurse was actually visiting the patient. That form of tracking, why is it important?
They are tracking a case that has been confirmed to have malaria and has been treated. So we are being tracked in the management of malaria. And that's where the T3, the track, last track, will come in.
Dr. Martin, what about incidences where perhaps a doctor or a medical professional would advise to treat even though you haven't been tested? As the patient, what do you do?
By policy and by international standards, if you have access to diagnostic testing, you have no other alternate but to test before you treat the person for malaria.
So, Dr. Martin, what I'm gathering from this is that if I go to the hospital, even though I trust the doctor's judgment or the medical professional's provider's judgment, I must insist on being tested.
Yes, of course, because that is the standard WHO recommended and even a policy in Ghana. You have to go for a testing with the approved kits or method or tool.
Speaking about approved kits, I go to a pharmacy. I have some of these symptoms you've mentioned. I'm inclined to just quickly ask for medication. There, what do you also advise?
Most of the pharmacies now will even test you. They will test you.
They have the
approved kits. They will test you before they give treatment. I remember about 2 weeks ago, I went to a pharmacy shop. They tested somebody for malaria. It was negative. They advised otherwise, and they didn't treat the person for malaria.
So once they did the test and the test wasn't positive for malaria, what you're saying is the advice was to what? Not to go through the treatment?
Don't give anti-malaria treatment. Look for what is causing the patient to come to the hospital. Don't take anti-malaria treatment if the test is negative for malaria.
So ultimately, we come back to the fact that the healthcare facility is best to go and get a test. It's best to take to get your treatment.
Yes, very important. Very, very important.
Doc, in my 30-something years of being alive, I've had malaria so many times, such that I am aware of what drugs to take. So I go to the pharmacy. I have the symptoms. I go to the pharmacy and I ask for whichever drug that of my preference. What are the dangers in doing that, Dr. Barton?
We have a lot of dangers associated with that.
Self-medication.
Self-medication. Because to start with, you don't know what you are dealing with. And then why do you ask for something to treat what you don't know? And then more importantly, as we discuss, many causes. You can have a lot of diseases presenting the way you are feeling. So maybe you are suffering from disease B, and because you thought you had malaria, you went and collected medication for malaria. you know what will happen. You will die from that disease. And people will say, oh, he was suffering from malaria.
And it wasn't.
It was not malaria. So self-medication is very, very, very dangerous because you don't know what you are dealing with. And right now, we have a lot of different diseases moving around. We know what is going on in Ghana. So if you just narrow your attention because you don't really know and you think, oh, it's this, doctor, give me that and I'll be all right. You are really doing harm to yourself with self-medication.
Dr. Boateng, I keep a bottle of painkillers in my handbag. I mean, the moment I have a headache or a migraine, and the moment today I say, oh, I feel a little cold, whatever it is, I say, oh, it is stress and probably some malaria parasites. But the fact is there are a lot of people, and those of our viewers watching as well, who self-medicate, with painkillers without necessarily wanting to go get tested. What are the dangers with that as well?
What is causing the headache? As we are discussing, about 1,000 things are going through my mind what can cause that headache. So in taking that paracetamol or Diclo, have you really addressed the cause of the headache? And then, because you have done that, you are living in kind of, let's say, oh, I'm taking care of this problem. But really, the problem is there.
It's lingering.
And you never know when it will become severer, that suddenly maybe you might collapse. Or you get into the severe form of the minor or the milder problem that you're having.
So, Doc, with everything that you've explained, the testing, the treatment, the tracking, ultimately, I'm gathering that prevention is better than cure in the first place. What's your advice about the long-lasting treated mosquito nets?
That is the way we have to go, especially for children under 5 and pregnant women. So as part of their education, when you are educating them as to the need to complete their dosage or their medication, you also tell them that they have to sleep under what? Mosquito nets, whether under 5 or pregnant women. We also have other stuff that we use, skin repellents that are on the market. You also make sure that when you are going out in the night, you make sure you wear long sleeves, things that will cover your exposed body, so that you are not bitten. And then most of the time, you also kind of have water in our barrel, in our buckets that we don't cover. Clean water. That is a very good breeding site for the mosquito. So that if you don't cover them, the mosquitoes will then breed in that. So normally when we are talking about environment, people are looking at the fields. That is good for different prevention. But in malaria, the parasite would like to be bred in what? Clean water. Sunlit, clean water. So we make sure broken bottles and all cans are cleared off from our environment. These are some of the ways that you have to do to make sure that you prevent yourself, your children, and the pregnant women from getting malaria.
Dr. Boateng, thank you so much for joining us on the program this evening. So what I gather and what I've learned is very important words, 3 words, T3. Get yourself tested. It doesn't matter how much you think you know your body. Allow yourself to go through a treatment. That treatment is important to ensure that you cut off that malaria. And most importantly, even if you are not tracked, track yourself. Finish your dosage. At the end of it all, prevention is better than cure. Remember to sleep in your treated mosquito net, not only for a portion of the night, but also through the night. Your health is your strength. And remember, we're building a strong Ghana. See you next time.